Knowing that Shanti was recently diagnosed with a lung tumor, we suspect that it probably is carcinoma, and the fact that there's another one, we know that it probably has spread. And so to put an older dog like Shanti through surgery, knowing she may not make it through, and she's a polar bear of happiness right now, like it just doesn't seem right. So we might as well allow her to live her life as a happy girl, eating amazing quality food, until whenever that time is for her that runs up that's good quality. You would come to me, say 10 years ago, I would have said to you, well, here are your only options. We can give IV chemo, we can give maybe a chemo pill that might not work, and if you want anything else, you have to go somewhere else. And that's really tough, knowing that there's a list of side effects that goes along with all of these other options. Or what we did was, let's see if we can get her GI tract in order so she gets to eat and enjoy her food and not feel sick. And then we can start adding in herbs and getting her overall more balanced so she's a happy girl. And then we start adding in some of the anti-cancer stuff, because if I had just added in the anti-cancer stuff, I honestly think she would have just felt sick. And that would have been horrible. Knowing that I wasn't getting the long-term control with just Western medicine. These dogs were still passing away from their cancer, and a lot of them didn't have the quality. And so it seemed like it was like almost like a chemo factory. They were coming and getting chemo out the door. And something didn't feel right to me. I felt like I wasn't doing everything I could. And owners were asking, I moved to LA and people were asking, well, how about this herb or how about that? And I would say, look, I really don't know anything. I can do the Western oncology and then you have to go somewhere else. And it just didn't feel like I was doing, and I would always say, I don't know if they're going to interact. You have to ask your, holistic doctor. And so I said, I have to make a change. So that's why I decided to go to school and go back. I actually went with Gina Kwong. We took an herbal medicine class. So now I'm certified in Chinese herbal medicine. And it has been an absolute life changer. I mean, in that I'm able to see a patient now from like two sets of eyes, right? I can see a patient from Western eyes and say, well, this is the diagnosis. But from an Eastern standpoint, they are also deficient in X, Y, and Z. Maybe they're deficient in yin. And so they run very, very hot. And, and that's why Shanti pants a lot. So we need to find ways to try to bring down some of that heat. I had a yellow lab. He was my best friend. I had him when I was 15 and he passed away when I was almost 31. And Otis was his name. He was smaller than Shanti, but that white yellow lab that Shanti is. And he ended up passing away at the end because he just couldn't walk, And I always thought he was going to get cancer, and he just couldn't walk. And so you don't know, is that just an old age thing that they don't live to 70 and have great grandchildren? That's what they should. And I guess if that really happened, you'd probably never get married. You would just have Shanti for the rest of your life, right?
True.
I mean, most of us would just have our best friend with us forever, right? Because they just give and give and give, and they take so little. In her case, I think the thing that I thought was really important that we talked about a little bit earlier is getting that GI tract in check, making sure that we can actually put other herbs and chemo pills or whatever we're going to do on top of all of these, this balancing kind of support that we need to do. Well, how do we do that is until I can get our GI tract in order, I can't do that because she's going to have diarrhea from everything I give her. So what we did is we actually gave her a supplement that helps support her spleen qi. Okay, spleen qi is something that gets lost when our overall qi gets reduced, and qi is that energy force. So in cancer, a lot of times it's that qi that's deficient. And the qi also supports our immune system. Our immune system is so important. I can try to help prevent the spread of cancer. I can help try to reduce the growth of the cancer if I can get her immune system in check. So we had a pup who was so sensitive to all these medications, and now, Liberty, how many medications is she on?
She's on, like 12.
12, twice a day, pretty much, right? And she has perfect poop.
Yeah.
And she's, knock on wood, hasn't been vomiting at all. And we have her on all these kind of balancing things. And then we've added in now, because her stomach is so strong, we've added in anti-cancer. So when you think about what we did for Shanti, what we did is we put her on something to support her immune system and build that qi. And then we found ways of trying to break up that stagnation and that phlegm so we can try to allow things to flow. When I say things, I'm talking about blood and qi to flow much easier. The other reason I think herbs are going to be helpful for her is that it's all about quality. I mean, it really is. So it's all about supporting her quality and making her feel like a happy puppy for as long as we possibly can. And if I just pound her with just Palladia, she'll eventually feel crappy. And she'll vomit and she just won't want to eat. One of the synergies that there's some anecdotal evidence that supports it is the synergy between Palladia and cannabis. And it is strictly anecdotal. There's nothing yet been published, but certainly there are some tumors that have responded amazingly to that combination where you found resistance to just that Palladia was growing despite it. You add in cannabis and the tumor starts to go away. So cannabis is going to help balance your system, right? And so using that helps with the arthritis. And in Shanti, you're using a company that is literally custom making it for her. So what they realized is they looked at her whole body, right? Because they have all of our notes and they have your notes and they say, look, we need to find something that will help her arthritis, help her cancer, make sure we don't upset her stomach. And so we need to maybe be a little bit more careful in giving her too much oil or use very small amounts rather than full mLs that might cause diarrhea. And so slowly getting her body used to the dosing so we can hopefully get some more anti-cancer effect, but also help her arthritis. CBD and THC is shown to have, help with pain. Certainly, Epidiolex just finally got FDA approved and now is used for seizures in kids, right? Finally, the first CBD, cannabis product has been approved and being used. And I hope and hope and hope that that happens in veterinary medicine as well, because these patients respond so well and they feel better. And it's not, you have some patients that say, oh my God, I started this and it's like, you gave my dog a whole new life. And others say, God, I don't see as much of an improvement, but I certainly notice they don't get sick with chemo anymore. And we know in people, it's rampant. I mean, people are using cannabis to help not get sick with chemo, right? Reduce the nausea, allow them to eat a little bit better because it causes the munchies. I guess one of the myths we'll say is that in dogs they don't really get the munchies as much, right? And I don't know if that's, you would agree with Shanti.
I think Shanti's always hungry.
She's just born with the munchies.
Exactly.
There's a lot of integrative oncologists, not a lot, there's a few of us out there, but certainly we all use herbs to try to prevent nausea, because as oncologists there are certain cancers that chemo's really the only really effective way to treat this cancer. But we don't want the animals to feel sick, right? We don't want the patients to feel sick because they're, again, I said it earlier, they're not going to live to 70 and have great grandchildren. We can't tell them, can you go through a year of hell and then you'll be okay? We don't know what Shanti's lifespan is. And her legs are such an issue too, that I want to know that whatever the time it is good times, that when you think about it, you don't look back and regret doing any of this. And so I remember when we talked on the phone, I was like, I support you 1,000% not going to surgery. Do you remember? And we were like, what do we do? And I went through the pros and the cons. But I know even if it's getting larger, which it is, right? I mean, it is getting larger. We don't know what's happening this minute, but it was getting larger a few weeks ago when we took those x-rays. I still think we made the right decision, because who knows, she'd even be here right now. And if she would have recovered. And so now it's all about her feeling. First one, this is the 8 gentleman. Shanti loves her 8 gentleman because she's a little hottie, and she gets 8 gentlemen to help soothe her stomach. So this helps soothe her stomach so we can pile on all these other herbs that we were talking about earlier. This is Shanti's Wei Qi booster, and this helps boost her qi and support her immune system and make her body kind of boost her energy level, makes her feel, gives her a little bit more energy, makes her feel overall just better, and helps her kind of, when she undergoes the chemo or the Palladia in this case, it kind of helps her overall a little bit, makes her constitution a little bit stronger. And this one is called Lily Formula. Lily Formula is a particular herb that can either transport other herbs to the chest cavity or directly go to the chest cavity and break up that stagnation that we talked about. And so that's what this herb is going to do.
She likes her herbs.
She loves her herbs. Do you realize that you found the 2 vets that love yellow labs more than anything in the entire world?